Are you insecure about your teeth? Maybe a dentist made you feel ashamed about your mouth's condition, or you just don't like to smile in pictures. Well, today you're in luck because we're gonna show you how you can achieve the smile of your dreams in today's episode of Your Health Matters. We're traveling across the country to meet with leading medical professionals that are helping people just like you step away from pain and discomfort and lean into their most happy, confident self. Has a dentist ever made you feel embarrassed or ashamed about the condition of your mouth? Maybe it's just been a long time since you've been to the dentist and you feel self-conscious about your smile. Well, listen up, because today's episode of Your Health Matters is here in the great state of Tennessee, known for its barbecue and whiskey, and big cities like Nashville, Knoxville, and Chattanooga. But right smack dab in the middle of all those cities is Cookville, Tennessee, where there's a dental practice known for its advanced technology and an environment that'll make you feel right at home. It's why people are traveling from all over Tennessee and beyond to receive the compassionate care at Hayes Family Dentistry. Let me show you. Hayes Family Dentistry is where patients with a lot of fear and anxiety come to get the smile of their dreams. It's because they offer sedation. With sedation dentistry, you can fit a lot of procedures into one appointment, which is great if you feel like there's a lot of work to be done in your mouth. And today, I cannot wait to introduce you to the two dental experts behind this practice. Come on. Well, now we're nice and comfortable in the waiting room that is just beautiful. Thank you for having me, Dr. Kevin Hayes.
Kayla, I'm very glad you made it. Thank you for coming to see us.
Oh my gosh, and the town is gorgeous. Your building is gorgeous. I'm really excited to get into it.
Thank you. I appreciate it. We look forward to sharing it for everybody.
Well, good. Now, I want to get to know you. I know that's why a lot of people choose a dentist, is because they trust the person. Why did you decide to become a dentist?
Well, early in life, my mom was pushing me to be a physician. And so my dad was in the school industry. So all his bosses were either the doctor or the dentist of town. So I found myself hanging out with the dentist kids because they had more fun.
Okay.
Their dad was a t-ball coach. Their dad wasn't at the hospital all the time. So it was really a lifestyle choice. It was about being with family.
But still getting to provide care for people.
Absolutely. Yeah, I got the best of both worlds.
What do you love about being a dentist?
Well, early on, it was about learning. And it was about sharing what I'd learned for all those years. I got out of dental school pretty young. I graduated at age 24.
Wow.
And everybody looked at me and said, you shouldn't be out of high school yet. So early, it was about learning. And I wore a pair of glasses sometimes just so I'd look like I knew what I was doing.
Love it.
Not really. But later, it became about the team. It was about teaching my team how to take care of the patient so we could all do it together. So now, we hear all the time, and I'm shocked by my reviews sometimes when they say, even from the front desk all the way to the back, I can't even put the words in that my patients share.
Oh my gosh, well, I believe the Google reviews. When I walked in, I was greeted by everyone. Everyone is so kind here. I love it. Let's get into what you do, right? What is sedation dentistry?
Sedation dentistry is us using medication, similar to what they would use in a hospital setting, to take away pain. Some of my favorite things to say to a patient, we're talking about sedation. I might describe what I'm going to do. And if I think they really need sedation, and they're like, no, I don't think so, I might describe in detail what I'm going to do. And then I say, would you like to be awake or asleep for that? Country boys around here like to say, Doc, you're going to have to knock me out for that.
Yeah.
So then I come in, the patient, the ladies have already got the IV started, they've already got medicine ready to go. And all I say is, are you ready for a nap?
Oh yeah, naps are easy.
And everybody goes, oh yeah, I've been waiting for a nap. 20 minutes later, 4 hours later, you're starting to get more memory back and you're coming around, you're like, is that it?
People don't even know?
No, they're surprised it's over already.
Wow.
You didn't do it. It hasn't been done yet.
So they look in the mirror, right?
Absolutely. Yeah, absolutely. And they usually go home and take a nice nap. So it's dentistry all the way from simple fillings to complex rehabilitation, surgery.
And one of those things is dental implants, right?
Dental implants.
Can you tell me about those?
Absolutely. A lot of people have lost teeth, one tooth, all of their teeth. So dental implant could be something as simple as replacing the root of one tooth, and you place a crown on top of it to you need a full mouth or a full arch, and you might have 5 or 6 implants.
So is there ever too many teeth, that need replaced, or is there, a limit to that?
Well, that's a good question. We're able to, we might have 28 teeth. You don't need 28 implants to replace 28 teeth. So if you're missing one tooth, say there's one on the lower right, you'd have 1 implant and 1 crown, and that would take care of that. That would take the place of like a bridge.
Okay.
In that situation, you're affecting 3 teeth in the same area instead of just affecting 1. Now, let's say you're missing your 14 top teeth. Well, it might just take 5 or 6 implants to be stabilized for you to be able to bite off an apple, chew steak confidently, smile without something slipping out and getting embarrassed. Generally, the men, they want to chew.
Yeah.
The ladies, they want to smile and chew.
Yeah, right, of course. We don't always want to talk about that part, but we want to look good, right? Yeah.
That's right.
Oh my gosh. So sounds like it's really personal. You create plans for people because you care about them. You want to do what's best for them. Tell me about the other values of this office.
I talked about the team before.
Yeah.
And, major companies all the way to small companies sit down and talk about what their core values are. What's their why? Why do they come to work? Why do they get out of bed in the morning? Growth, respect, and trust. Those are the core values that we hammered out over multiple meetings, over multiple days, and came up with as a group for our team at Hayes Family Dentistry.
Sounds like that probably flows into the patient's perspective as well. I mean, they're probably growing as people as they get these, beautiful smile.
Sure.
And they trust you. I think that's really important. And I bet it shows in your patients.
Thank you.
Anything else I should know before you give me a beautiful tour of this place?
We started this team 25 years ago.
Yeah.
And my personal vision had a lot more to do with the team than 25 years later when the team were really running the show. I wanted to share that our vision as a team then, as we were getting into sedation dentistry, was the faith to believe, the love to support, the growth to embrace, constant, never-ending improvement in an effort to reach our God-given destiny, a destiny of excellence.
Do you feel like that's yours and yours is in dentistry?
I have a hard time sometimes separating what the team from the personal, but it all mixes together.
All right, well, let's see what it's all about.
Okay, now we're going to show you what's going on back there.
Sounds good.
Right. Do you need to be sedated or think we can get through this?
I don't think you have to knock me out, Doc.
Okay, here we go.
And now we're here in a consult room where I have the pleasure of introducing you to another doctor here, Dr. Sandy.
Hello.
Yeah, hello. Oh my gosh. So I was hearing little bits and pieces of your story. It sounds like you're very passionate about what you do.
Yes.
Tell me, why sedation dentistry?
It's very passionate to me, very dear to me, because when I was very little, I had a dentist treat me not so well, and it scared me really badly. As I got older, I didn't want to go to the dentist. I didn't want to have anything to do with the dentist. And I ended up going to someone who was very calm, very gentle. And I decided as a very young girl, if I could do that, that's what I want to do. I want to make sure that everyone has a gentle experience when they come to the dentist.
You seem really gentle. Yes. I love that. There's a lot of people at home who can probably really relate to that story.
Yes. And I will tell you that what's important is when you are treated poorly and you're scared, you stay that way. So even if you are an adult like me and I have to have dental work done, I go into the chair and I'm that little 4-year-old girl again, and I'm just as scared. So having some place where you can be appreciated and know that's what we have here. We all know how scared you are, and we're going to hold your hand through it, and we're going to understand it. We're not going to belittle you about it. We're not going to act like, oh, just grow up. We want you to know we respect it, and we're going to take care of you.
Oh my gosh, wow. So that's powerful. How do you think sedation could change someone's whole vision when it comes to dentistry?
If you have the ability to smile, if you have the ability to tell others how much you have loved something, you can eat something, you can be with someone. And for my mom, it was even about being able to taste food.
Oh, tell me about your mom.
So my mom and my grandma both had dentures by the time they were 18 and 19.
Wow, that's young.
That's all they had for their dentistry back then. And it was very scary too. So when my mom was then later 45, we were able to put implants in and give her a bridge and throw her false teeth away. And she began to smile more. She kissed my dad more.
Oh.
She had food that we actually could taste. It wasn't so spicy.
Yeah, right.
So it changes your life.
Oh.
Her and my mom and my dad were, like very strong couple, but she became like amazing woman just because she could smile and not be scared. I didn't even know when I was raised, I didn't even know she had a denture. Wow. She wouldn't even show it to me. I'm in dental school and I realized my mom has a denture. What? So it absolutely changes your whole life.
It's a new lease on life.
It's a new lease on life. So being able to go to a dentist, not be scared, being able to have false teeth away from implant surgery, all of that just changes who you are. When I think of what I'm doing for my patients, I think of my mom. I think of how it changed her life, how it changed her life with my dad. I think about not being scared as a little girl. And so I think we have an opportunity to change people's worlds. They are different. They become more of who they are. My mom became a teacher. It's just different. It just makes you like see the world for a whole new place.
Wow. And you don't even realize how much your smile really makes you act different, talk different, do things. And I mean, we all want to look good, right?
Right.
So let's talk a little bit about cosmetic dentistry.
Okay. As a young child, I had white spots on my teeth. We didn't have the money to get crowns. We didn't have the ability to go, plus I was scared to death, right? So when you talk about cosmetics, you want to be able to have the ability to smile. And that, what's the freest gift in the world? Is to give someone a smile. So if I smile at you, what do?
Smile right back. Yeah.
But if my teeth are black or white or missing, then what do? So when you have the ability to give someone a smile, that changes their life, that changes where they are, that changes who they are, whatever it takes for you to feel comfortable, I want to be able to do that.
Is there anyone that's a lost cause, or maybe they feel like they've got too much going on in their mouth? Is that such a thing?
No. I always remember my mom. If she can do it, and she had a beautiful smile, and she changed her life with my dad, no, there's no one out there that's a lost cause. She had a denture at 19. It was 45. She was 45 when we did the implant surgery in the bridge.
Wow.
So there's never a lost cause, ever.
I love that. I think you even have a story about someone. Well, I heard maybe, one of your patients is in a very famous book. Let's talk about how there's really no lost causes here.
I had a patient that was a nurse for an elderly lady who was on her deathbed. And she wanted to see Jesus with teeth. And she had false teeth. So I had lost them, something had happened, and so she couldn't have them anymore. And she did not want to go to heaven without teeth. So me and Sue, she was the nurse, we drove a very long distance and we did everything we could from her home. Then I had the dentures made, and then I gave her her dentures. That night she saw Jesus. So
with her teeth.
With her teeth. And that's all that mattered to her. And so we don't realize how much a smile means just in every day. She didn't even want to go to heaven without him.
Wow. Oh my gosh. Yeah, much less, go to a job interview, go meet the new boyfriend, girlfriend.
Exactly.
It's just, it's your whole life starts right here.
Or look at your grandkids.
Yeah.
You want to hold your grandkid and he goes, Mom, Grandma, look what Granny's got, right? Look what Granny ain't got, right?
But you guys don't do that here.
No.
I love that. Well, thanks for sharing that with us today.
Thank you.
I'm Kimberly, 50 years old and a mother of 8. I had 2 teeth pulled where I live in Smithville, and they pulled one of my teeth and I could hear it cracking on the other teeth. And when they pulled it out, I felt a little bit of roughage on my other tooth that was beside it. And I told them, I said, I think this tooth is cracked. I heard it crack. And they said, oh no, it's not that. It's probably just debris from the other tooth. We'll wash it off. And they washed it off. And so for about 3 months, I walked with that broken tooth, and I went back up to the dentist, and they said, well, we can fix it, but we'll have to charge you again. It wasn't my fault. It wasn't my tooth's fault. It was their fault. And I told them immediately. And so I was just like, I can't do that. I can't do that, So I just didn't go anymore. I just didn't go anymore. I felt, you know, if my dentist isn't going to take care of me, then why should I go? And I felt like they just wanted my money. They just wanted me, my money. They could have fixed it right then that day. They could have put something over it, sealant or a fill-in or a cap or something so it didn't get worse, but they didn't. So I didn't go back. I was in a very big state of depression with these teeth right here. I gained a lot of weight because I went into self-depression. I was 255 pounds because I would eat myself with depression. I walked around for probably 20 years like this. It didn't start off like this, but it ended up like this. And this smile, it's not the smile I have today. Personality-wise, very depressed. I should have never let it go that long, but I did. I was scared of the dentist. Hot flashes, scared to go into the dentist. I would make appointments with dentists and I'd cancel. For about 3 years, I heard on the radio about Hayes Family Dentistry, and I'm like, they can sedate me? That's good. That's good, because they would have to get my nerves away in order for me to do anything. My dad passed away 2 years ago, and his last wish for me was that he just wanted me to smile again. So my inheritance was Dr. Hayes. The money that went for my smile come from my daddy. And I was still scared. So about 1.5 years ago, I did it. I just said, you know what? I'm going to make my dad's last wish for me come true. Made the appointment, was in the parking lot for a few minutes, wasn't gonna go in. I was that scared, wasn't gonna go in. I said, no, I'm gonna go in. I'm gonna do this. And I walked in, and from the time that I walked in, it was amazing. I was like, oh my gosh, they're like me. They're so sweet, they're awesome people. They went over step by step by step of everything they were gonna do. They did not leave out anything. Any questions that I had, they answered immediately. We set up surgery. I didn't feel a thing. Didn't even know I existed in this world until I woke up. Didn't have really any pain. After my new teeth, my self-confidence came up. I was smiling to everybody. Now I'm down to 174 pounds just because my self-confidence is amazing. I tell everybody about Hayes Dentistry, everybody. I've had 4 people already call up here to get their teeth done because they know me. They know how big of a coward I am. And for me to do it, I know they could do it. So it's awesome. Hi.
Hey, Kimberly.
How are you?
Good. How are you doing?
I'm doing good.
It's good to see you.
I'm healthy, and I have 8 kids to live for.
Wow, amen.
You gave me my life back. You gave me more time to spend with my children.
Yeah, I want to get my smile redone now.
Oh, well, hey, I know a great dentist that can do that.
Where should I go?
I think you should go to Hayes Family Dentistry.
Okay, that sounds like a good deal.
Yes, absolutely,
Yeah.
absolutely.
So Dr. Hayes just walked me through this beautiful building, and oh my gosh, it is so comfortable here. So it can't just be by chance that it smells so good in here, right?
It's not so much what you're smelling, it's what you're not smelling.
Oh.
There's a lot of chemicals that we used in dentistry decades ago. There's a lot of memory attached to smell. I'm a bit of a stickler when it comes to this smell.
Okay, I like that.
It's in the office, it's in a glass sealed jar. If they get it out, they only have a few seconds to use it. Then it gets resealed in plastic and removed from the office.
Oh, so that's why it smells like flowers in here.
I think that's probably true. I think we probably had some kind of a floral air freshener, but it's about the eugenol that you're not smelling.
Yeah, that can be, I'm sure, triggering for people. So I'm sure this is already a more comfortable environment because of that. And another thing I thought about is, it doesn't sound like a typical dental office.
You caught us.
Okay.
You caught us. So we have soundproof in the walls. We actually had the studs for the walls separated so that insulation could run through them and they didn't touch each other.
Wow, so technology even running through the walls of this building.
Well, that's a good old boy technology.
I love it.
We just didn't want to hear it.
And I bet you treat a lot of those good old boys.
Thank goodness. Thank goodness. I got to tell you, that smell is also a personal experience.
Yeah, tell me
I
about
remember when I had dental work done, and that smell just reminds me of when I had that dental work done. So that was real for me.
Yeah, so you kind of understand where patients are at when they are fearful.
I do. My first memory of life was being put to sleep. And I said, well, if you're going to have anything done, being asleep just makes sense.
Yeah.
Even now, I prefer to be asleep. to have my work done.
How else do you make patients who are sitting right here in this chair in the exam room feel comfortable?
Well, one of the things we always try to do is not to be above them. Like I want to meet someone eye to eye, or even maybe looking up a little bit.
That's kind of nice. It's personal.
Yeah, absolutely. But also, it can be intimidating to be this close to someone.
Yeah.
And if you're standing over them, it's just not comfortable. We work really hard for you to be comfortable. Why blow it with eye contact?
Oh my gosh, yes. Tell me about this room.
Well, we like to do things a little bit different. So one of the things we have is a big window during the day. You can see out, you can see the trees, you can see people walk by, and that's kind of nice. And then in this room is some newer technology, digital x-rays, that allows us to take what used to be a small piece of plastic film and put it up on as big a screen as you have.
Oh, okay. So that the patient can see it?
Absolutely. You're looking at a screen right here.
Is that how you explain the process to somebody? By showing them?
A lot of people are visual.
Yeah.
There's a very few of us are auditory, but they get to listen to us talk anyway.
That's right.
So visual works for maybe 80% of the people. And when they see a picture of it, it's a lot better explanation.
Yeah, and I love that you take the time to actually explain it to patient.
It works a little bit better when you can try to relate to that person, maybe what they do for a living. I love having the technical people come in, because then I can kind of talk technical a little bit.
Yeah.
But the analogies work better if you just talk about putting a nice house on top of a good foundation. The implant's the good foundation. The house is like a crown for any other tooth.
Well, who might be a candidate for a dental implant?
Just about everybody is a candidate, but mainly you're looking for somebody who's lost one tooth, so they would have a single implant, or maybe they've lost all their teeth.
Different than dentures, right? Like they're permanent, they stay still.
This is fixed. This is fixed in. You don't take it in and out. Two of the other technologies that I really like in here are the digital scans.
Okay.
So when we're taking a scan of this, have you ever had a big goop of mush put into your mouth to take an impression?
Yeah, and you have to sit there and you can't breathe, and it's not great.
Yeah, I'm a little claustrophobic.
Yeah.
And I don't like all that in there. What we've got now is called a digital scanner. It's taking a computerized picture as opposed to all the goop that we used to have. We scan your mouth, we take it to a computer, we place the implant exactly where we're going to put it, then we 3D print a guide that shows us exactly where to place it.
Wow, so no guessing, you know.
No guessing. It's going right where it's supposed to go.
I love that.
We
3D printing.
do it ahead of time. 3D printing in a dental office, imagine that.
Yeah, that's right. I did not expect that.
And then we can take that and make 3D images. We take that and we can make appliances for your mouth from it. And we actually send it electronically to the lab.
And you have it right here, the lab?
Absolutely.
So man, everything's right here. I feel like that makes the process quick and efficient. How long does sometimes dental implants take for people?
We place them and we usually wait about 3 to 6 months. And there are differences to that, but by and large, 3 months is a really good number.
Okay, yeah. I think if people have waited their whole life to be confident in their smile, 3 months is nothing.
Yeah, absolutely. It flies past.
So Dr. Hayes has showed us all of the neat technology, like 3D printing and quick scans and x-rays that you can look at together. So you have your plan. Is the next step sedation?
It's time.
Okay, tell me about it.
Well, you come by the front desk and you get the normal greeting that you've always gotten from the great team at the front desk, and they escort you back. They make you go to the bathroom before you go back, just in case.
Fair.
And they come in. Usually we use some laughing gas. Well, we do that just to start the meds. Okay, so we kind of just smoothly transition into the meds, and then nitrous goes back off. You're kind of looking around, ready to go. I walk in and say, "Hey, are you ready for a nap?"
And I'm sure people can say yes to that.
They all do. I can kind of tell right then if it's going to be a great appointment or it's going to be a good appointment.
No bad.
No, there's no bad appointments, but sometimes I get a response like, "Oh, am I ready for a nap? I didn't sleep last night." You know that's going to be a good one.
Right,
And then
yeah.
there's those, "Yeah, I'm ready." That's going to be a good one. They're going to have a nice, comfortable appointment.
Yeah, and then they wake up, right?
That's their version of what's going on. You know, we might get in there and fix a couple teeth, and then next thing they know, they're like looking around and, "Are you done?
No.
Did you do both of them? Did you get all 3 of them?" "Yes, we did. You did great."
Wow, so you can do multiple things while they're asleep.
Huge advantage.
Yeah,
Yeah.
rather than coming back to the dentist over and over again. I mean, that's super nice.
Time and fear. You don't have enough time, you got too much fear. We can take care of both those.
Okay, so they wake up. They're thinking, this was way too easy.
Yeah, I'm not sure I really got done. They get out to their ride home. They can't drive. They get out to their ride home and say, "I think I'm ready to go," but it didn't take very long.
And then, is that when their life has changed? I mean, you've done the work. how do they feel after?
Well, they usually go home and take a nap. And the person with them has already seen, oh my God, look at your smile. But they got a little sleep to do. So they go home and take a nap, and that's when they're waking up. And that's about the time I call them and said, hey, I'm just calling to see if you need anything for tonight. How you doing? Do you have any questions? My mouth looks great. I can't believe you did that. That's what we do it for.
Oh my gosh, so you really walk them through the whole process. I mean, up to the phone call after.
No surprises. That's their goal.
I love that. Okay, so what are some of the reactions? What are some of the things you've heard over the years?
Just today, I heard a great response. You changed my life.
Oh.
I lost 90 pounds because of this. I was depressed.
Yeah.
You know, there's things we don't see that every day.
Wait a minute, 90 pounds? I mean, I wouldn't even imagine that the mouth really made that big of a difference on your health overall.
Eating the right foods, being able to chew the right foods, you're eating apples instead of applesauce.
Oh, yeah.
That's what I learned recently. Now, you've also got to take into account the emotional side for it. You smile, you feel good about yourself, you're confident. It's emotional health, not just physical health.
Yeah, and that really does impact everything. I mean, once you feel good, you want to look good, you want to do better for yourself, for your kids, for your family.
I think it just brings what's on the inside out. It's already there. Knowing that the outside looks as good as you feel on the inside, it makes life congruent. And we're not promising 90-pound weight loss for everybody who gets their teeth fixed, but it does have that impact. It can change your life that much.
When someone walks in, do you see that in them, the inside?
Sometimes the fear covers it up pretty good. I'm able to look in their mouth and know what it could look like their mouth could look afterwards, but I get surprised sometimes by how great the person on the inside is finally gets to come out. That's a great surprise.
Oh my gosh, I bet they are just so grateful for it.
Absolutely, and that's how we get rewarded.
Yeah.
We're grateful too.
Is there anything that keeps them from making that phone call, that first phone call to set up their appointment?
I've heard people say they pick up the phone 10 or 20 times. Ultimately, what brings them in is they finally get to the point where they're in pain. They can't talk themselves out of the pain.
Right.
You can only walk the floor so many times.
Well, hopefully they hear your story and they hear how much you really care about them and they pick up that phone before they get to the pain.
That would be great. It would make it a lot easier on everybody. But we're there whether you've gotten to that point or not.
What a gem Cookeville, Tennessee is. You may have already known it as the home to one of the best technical schools in the country, Tennessee Tech, but now I bet you'll never forget it's home to Hayes Family Dentistry. And it makes sense that they have some of the most advanced technology available in dentistry. And when you mix that, the 3D printing, the quick scans, and sedation with the care and compassion that you'll feel from Dr. Hayes and his team, it just can't be beat. So give this place a call if you're sitting there right now, not confident in your smile. Because when you walk through these doors, you're not just another patient, another number, you're family.